So thank you, Mr. Chairman. Thank you to the organizers of this very interesting congress and to Dr. Pietrizzi for having allowed me to be here today. Before showing the results of our experience on Charcot foot disease, I would like to remind some general information about Charcot foot. From the epidemiological point of view, we know that it's a quite rare disease, although the true incidence is not really known because no large prospective studies are available and most of them are retrospective. And by the way, the incidence reported in these two works is less than 1% per year. We know also that these patients present a long diabetes duration, more than 15 years. Most patients are between the 6th and 7th decades. There's no sex predilection, and up to 20% of patients present a bilateral involvement. And we know that up to 76% of patients refer mild or moderate pain. Neuropathy is always present, and another interesting information is that in 1/3 of cases there's a history of trauma or surgery, as reported by Professor Game. And another information about Charcot mortality is that Charcot arthropathy was associated with an increased risk of mortality compared to diabetes alone, but lower than direct foot ulcerated patients, as reported by Sun in 2009. In our study, we wanted to evaluate the outcomes of different offloaded treatments in our ambulatory dedicated to Charcot foot disease. And we retrospectively searched and interviewed by telephone all the patients attending our clinic between 2005 and 2009. And diagnosis was done on clinical presentation and confirmed with MRI. And patients were treated with several devices, as you can see in the following presentation, and follow-up was scheduled monthly until the negativization of clinical findings and with MRIs as confirmation. And the stabilization was considered when a durable negativization of both clinical and MRI findings was achieved. So Charcot patients represented 7.3% of the new diabetic foot patients attending our ambulatory between 2005 and 2009. And among them, only the real Charcot foot patients were 120 patients. The others were diagnosed as osteomyelitis, deep venous thrombosis in 2 patients, and 1 patient was an erysipelas. And the mean age among our Charcot patients was 56 years. There was a long diabetes duration and a quite poor metabolic control. We have observed a prevalence in type 2 patients, diabetic patients, and in 33% of cases there was a previous provoking trauma. Only 44% of patients refer to us pain,